My name is Desmond Carson. I'm an ER doc. Been practicing emergency medicine for close to 30 years now. A little briefing on who I am. I'm a local indigenous boy from born at Highland Hospital, raised in West Oakland. My parents migrated through Berkeley and we ended up in Richmond. I was raised for the most part in Richmond. Went to Richmond Public Schools, matriculated at UC Berkeley, studied biophysics. Went to medical school, graduated, and went to residency at Martin Luther King Hospital, which is in South Central Los Angeles, where we saw a lot of sick patients, very sick patients. I've already had COVID-19, so I have antibodies and do not need the vaccine. Wrong. Because you might or you might not have antibodies, and we do not know as of yet does that offer protection against the active virus COVID-19. So that's wrong, and you do need a vaccine. The vaccine was developed really fast, so they must have cut corners to get it done, and it may not be safe. That was the first question I had for myself. It was personal and self-serving and very selfish, that I was like, shit, is this stuff safe? I didn't know if it was safe neither. But when I was in medical school, we used to read the articles from various journals, and one of the journals that was what we considered the best journal was the New England Journal of Medicine. And New England Journal of Medicine, we would quote that left and right to say that this was right or wrong based on what the New England Journal of Medicine stated. And so prior to me receiving the vaccine, I looked at what the New England Journal of Medicine stated, and on December 15th, 2020, they put out an article concerning the COVID vaccine, its efficacy, i.e. does the shit work, and does it hurt you, right? So after they studied it, and they did a 1 month trial, then a 2 month trial, and a 4 month trial. Well, after the 1 month trial where they gave patients placebo, basically they didn't give them the medicine, gave them like salt water, and then the other half of the patients they gave medicine, they started to see that the patients who they gave medicine were being protected from the virus. Receiving an mRNA vaccine will alter your DNA. mRNA does not alter DNA. I've heard the side effects of the vaccine are really bad. The majority of people side effects are minor. Personally, the first day after the first shot, I had the Moderna. I didn't even feel it. The second shot, I had a little left arm pain, and I'm just a little tired on Saturday, and so all I did is slept so I can get ready for the Super Bowl on the following Sunday. I've heard severe allergic reactions are common. Okay, they're not common. Minor things, headaches, fever, body aches might occur. And that's just letting you know that your body is reacting to the vaccine appropriately and that you are building up immunity. I have chronic illness, so I can't risk taking a vaccine that might make me sick. I would believe that because you have chronic illness, that is the reason why you need to take it. I have diabetes, hypertension, not to spread my whole life, but so the best way to avoid dying from COVID is not get it. So that's why I took the vaccines. I'm very strong and healthy and careful, so I don't need a vaccine to protect me. Your health will not protect you from getting it. It might protect you from not getting as sick as an elderly person. The COVID vaccines don't work as well for seniors or people of color. So I understand the bias of the medical field amongst people of color, brown, yellow, black, blah, 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 black folks. I've seen the Tuskegee experiment, read on it in details. I've read on the helical cells, where a lady's cells were used for studying cancer. Even to this day, in 2008, they were using experimentation on black women in the jails. Now, hear me out. This ain't that. I'm gonna repeat that. This ain't that. I was the first. I tried to be the first one, and I'm black as anybody else to try to get in line to get this. So I'm here to tell y'all, in particular, because we dying from it. Black folks twice as much, Mexicans 3 times as much. That we should sign up so we can line up to get to this vaccine. If it's available in your community, I would encourage you to get it. Natural immunity is healthier and more effective than vaccine immunity. Natural immunity it does exist when kids go to daycare, and all of them share the same germs. I agree with you that those kids do get some good immunity. However, polio came through and did wrecked the United States, and then it wasn't until the Salks vaccine that polio was cured. So I don't know about all this natural immunity is better than. Some of the things that we are trying to fight against, we have not been exposed to, so it's hard to get the immunization. That is why we create vaccines, so that we can put a little bit of their DNA in our body, so our body can acknowledge when it hits us for real and be ready to fight. Vaccines have microchips and are used to track people's movements. No. That definitely is not true. Question 15, COVID is not that dangerous, so I don't need to take a vaccine. Well, you must not. You all you need to do is look at the nightly news and see the amount of people that are dying. More people have died from this COVID-19 than have died through all of World War II. COVID is ending on its own, not that I know, so I don't need to take a vaccine. As far as I know, the COVID is still alive, rampant on a rampage, and in particular of people who do not take the precautions of hand washing. You should wash your hands damn near till they raw every day. You should have social distancing. Some people say 6. I'm not going to be close to you at the store. I'm going to stay my 7, 8, 9 feet away from you. I don't know who you are. You could have it. And surely a mask. At least one. They now shown that 2 masks are better than 1, like 2 gloves are better than 1. So you should definitely have a mask, and the better the mask, and at least 2 of them if you wish, the better off you are. Those are the ways to stay protected.